Good afternoon, everyone. Hopefully you all remember me. I'm Mrs. Miller from Nurse 3. Welcome to Nurse 4. I know you were all excited and ready to go. I'm sure that every one of you have done all 60 problems that Mrs. Johnson assigned and read all the chapters in your Calculating with Confidence textbook. So I thought I would put together a little short presentation for you and show you how I would solve some problems that you will see in the workplace and on your test that you'll need to pass before you can go to clinical for Nurse 4. Alrighty, so I've set up 6 problems for us to go over. It should be pretty straightforward. The first one here, it's furodantin, oral suspension, 25 milligrams PO Q6 hours. Your patient weighs 37.4 pounds. And what you have available is furodantin, oral suspension, 25 milligrams per 5 mLs. The recommended dose range is 5 to 7 milligrams per kilogram for 24 hours, and then that total dose will be divided every 6 hours or 4 times a day. So the first thing you want to do, I'm sure you all know, is to convert your weight, which is your 37.4 pounds, into kilograms. So 37.4 divided by 2.2 is equal to 17 kilos. You should have that down pat. So the next thing you want to do, so you're going to work with 17 kilos, is you want to calculate your dose range for this child. So the first one is you're going to do the 5 milligrams. So 5 milligrams per kilogram, which is 17, is equal to 85 milligrams. So that's your 24-hour minimum dose. Then you want to calculate your 7 milligrams times 17 kilos, and that one is equal to 119 milligrams per 24 hours. But your question wants to know, is this dose 25 milligrams a safe dose? So your order is for every 6 hours. So you're going to need to divide this 85 milligrams by 4. So if you divide that by 4, your single dose will be 21 milligrams, 21.25 milligrams, and your 7 milligram will be 29.75. So if you want to look at this on a scale, your single dose range is a minimum of 21.25 milligrams minimum to a maximum of 29.75 milligrams. So your ordered dose up here is 25 milligrams. Does it fall between these two ranges, the 21.25 and the 29.75? And it does. So it is a safe dose. Yes. So then you've decided you have a safe dose. Then you're going to calculate your dose into mLs to administer if you're going to give it. So if you want to give you have 2 choices to do. I'll do first ratio and proportion. So you have 25 milligrams is to 5 mLs, because that is what you have available, and that is equal to your dose 25 milligrams is to X mLs. Now this one's a pretty easy one here, but if you do the math, so you do your extremes and then your means. This is your extremes, this is your means. So 25 times X is equal to 5 times 25. So 25x is equal to 125. To reduce that, you divide this by 25, this by 25. You cancel out. X is equal to 5 mLs. 25 goes into 125 5 times. So 5 mLs is what you're supposed to give. Just real quick, if you want to do desired over have, you do your 25 milligrams over what you have, which is 25 times 5, and you get the same answer, 5 mLs. Okay, that is your ranges. So we're going to now start a second problem. So the second one is a heparin IV dose. So it's heparin 1,550 units per hour IV. What you have available is a heparin 25,000 units per 1,000 mLs of half normal saline. And what I want you to do is calculate the rate in mLs per hour. The first thing that I would do is I look at my problem, and I always try to reduce my infusion bags down to the lowest common denominator, or what you can find in 1 ml. So if you have 25,000 units per 1,000 mLs, what you have, if you reduce that, is you have 25 units per 1 ml. So all you have to do is take 25,000 units and divide it by 1,000, and then you find out how much you have in 1 ml. By decreasing it to 1 ml, you decrease your risk of making a mistake because you have a smaller number to work with, and you finally end up just multiplying by 1 instead of by 1,000, which people make mistakes on because of the too many numbers of zeros. So make your life easy and make it safer by reducing it right away. So now we're going to set up our problem. So we have 25 units per 1 ml, and that is equal to 1,550 units is to x mLs. All right, so that's ratio and proportion. You're going to multiply your extremes and then your means. So you have 25x is equal to 1,550 times 1. So you can get rid of that because 1,550 times 1 is 1,550. So then all you want to do is you want to get rid of your 25s. You divide this by 25, and what you end up with is you have 62 mLs per hour. Desired over half, for those of you who do that, your desire is you have 1,550 units over, and you can use the 25,000 units. I would use the 25 units. 25 times 1 makes your life easy, gives you the same answer. You have 62 mLs per hour. Two ways to do the same problem depending on what you find is your easiest way to do it. Just be really, really careful. So our third problem is epinephrine. And when you looked at the PowerPoint, you will see that different medications come, either the orders are milligrams per hour, micrograms per hour, milligrams per minute, micrograms per minute, mics per kilo per minute. So you have to be really, really careful and pay attention. As you can see here with the epinephrine, this is an adult dosage. There is no weight involved. When you go into the pumps, you will have a choice of epinephrine, either weight-based or non-weight-based. So you have to pay close attention and look at your order. So this is non-weight based. What you have is an epinephrine. There's 2 milligrams and 250 mLs of D5W. So the first thing that I do is I reduce what I have to find out how much I have in 1 ml. So I'm going to do 2 milligrams in 250 mLs. And if you divide 2 milligrams into 250, you find out that you have 0.008 milligrams per ml. So then I want you to calculate the following. So how many milligrams per hour is your client receiving? So ratio and proportion, so you have 0.008 milligrams in 1 ml, and that is equal to x milligrams. Remember, pay attention. So on each side of my problem, I have milligrams on this side, and then I have my mLs on the other side. So that's how you solve your problem. So I have x milligrams in 30 mLs. That's what we have in fusing. So once again, 0.008 milligrams times 30 mLs is equal to 1 ml times x milligrams. So 0.008 times 30 is equal to 0.24 milligrams, and that is equal to 1x. So 1x is 1x. So what you're giving per hour is 0.24 milligrams. Simple as that. Nothing else. So how many micrograms per hour is your client receiving? So as you remember, there is 1,000 micrograms per 1 ml. Works both ways, or 1 milligram. 1 milligram is equal to 1,000 mics. It's all the same. So if your patient is receiving 0.24 milligrams, all you have to do is multiply times 1,000, and it will tell you that you are giving 240 micrograms per hour. If you want to work that out, you can do the 1 milligram is to 1,000 micrograms is equal to 0.24 milligrams is to X micrograms, and then do your math. So how many mics per minute is your client receiving? Not mics per kilo, but mics per minute. So if they're getting 240 mics per hour, what are you going to do? Simple, simple, simple. Divide by 60 minutes, and that will tell you that you're giving 4 mics per minute. Just think about it logically. Do it one step at a time. Alrighty, so the last one we're going to do is dobutamine. Your order says dobutamine 3 mics per kilogram per minute. So notice this one's got kilograms in it. What you have available is dobutamine, 250 milligrams and 500 mLs of D5W, and this is a standard dose you will find in hospitals. You will find your pumps are programmed for certain standard concentrations. It decreases the risk of making a mistake because people get used to what's hanging. Your patient weighs 176 pounds. So the first thing you're going to do is you're going to convert your weight from pounds to kilos. So 176 pounds divided by 2.2 kilograms is equal to 80 kilograms. Hopefully your patients will all come out to nice, even, easy numbers, but that it's not always the case. And just remember the rule according to the book and the standard is that until you get to the very end, you round your weights to tenths and leave them there until you get to the very end of the problem. So if this worked out differently and the patient weighed 80.3 kilos, calculate all of your medication order on 80.3 kilos. Do not round it to 80 kilos until you get to the end. That's the safest way to do it. And just as a matter of fact, the smaller your patient is, the more important it is. And actually, if you go to pediatrics or to an NICU, you will find that they actually will go to the hundredths. So you better sharpen your little math skills up. So the second thing we're going to do, so we've got 80 kilos. We're going to convert our infusion dose from milligrams to micrograms because you want to make what your order is, then you want to make your IV fluids match the same units. So 250 milligrams you want to convert to micrograms. So the first thing we're going to go is 250 milligrams is equal to X micrograms. And we all know that there is 1,000 micrograms in 1 ml, so we're going to multiply that by 1,000, and that's going to give you 250,000 micrograms. Make sure you keep track of all of your zeros because it can make a huge difference one way or the other on your dose because you're talking, 250,000 micrograms here. So you're going to infuse it. So what you have now is you have dobutamine, 250,000 micrograms per 500 mLs. So this is equal to this. It's the same thing, except now your micrograms matches what your order is, which is 3 mics, so you're less likely to make any mistakes. So the next step is you're going to calculate how many micrograms you have in 1 ml. So that's back to what my plan is where you reduce it to the lowest that you have possible because it decreases your risk of error. So you're going to take 250,000, divide it by your 500, and that is going to equal 500 micrograms per 1 ml. So you've decreased from 4 zeros down to 2 zeros, so a little bit safer. So then, what is your client's dose? So you go back up to the top. So you want to give 3 micrograms per kilogram per minute. Your patient weighs 80 kilograms. So 3 mics times 80 is equal to 240 micrograms per minute. So the next thing you want to do is you're going to have to set your infusion pump. So your pumps all end up infusing in mLs per hour, not in per minute. So you have to take this 240 mics per minute and multiply it by 60 minutes so that you get a total dose for an hour. So your total dose for an hour is 14,400 micrograms per hour. So that's the number you're going to work with. So you're going to calculate the rate to set your infusion pump. So you look at what do you have here in your bag. So you have 500 micrograms per 1 ml, and that is equal to, we want to give 14,400 micrograms per hour. Per XMLs. Skip that. 1,440 is the XMLs. So back to your means and your extremes. 500 X is equal to 14,400 mics. So you take your 500, so you can cancel out, so you have X. And then you put your 500 on the other side to make it work out. And so X is equal to 28.8 mLs per hour. Now just to make a quick one here, for those of you when you get down to this point, if you're doing desired over have, so you now know that you need 14,400 micrograms. You have 500 micrograms in 1 ml. Remember, it's desired over have times the quantity, 1 ml. So if you take your 14,400 and divide it by 500, you come up with the same answer, is equal to 28.8 mLs per hour. So those are two ways to solve that same problem, but my recommendation is learn the steps to follow so that you don't leave anything out, and always go back and look. So you're going to look at, remember, you've got weight on this one, and on the diltiazem drip, there was no weight involved. So you just have to pay close attention. Now, the last problem we're going to do is one more similar to the last one without all the prompts. So we have nipride, 3 mics per kilo per minute. You have nipride, 50 milligrams and 250 mLs of D5W. Your patient weighs 132 pounds. And we're going to calculate our flow rate, once again in mLs per hour, because that's what your pump is going to set. So step 1, we're going to convert our weight. 132 pounds divided by 2.2. Your patient weighs a nice magic even number of 60 kilos once again. Next thing we're going to do is we're going to convert our IV fluid milligrams to match our order of micrograms. So 50 milligrams is to micrograms. You multiply it by 1,000, so you have 50,000 micrograms. So your final is 50,000. Make sure you get all your zeros in there. Micrograms per 250 mLs. Once again, reduce to your lowest form so that this ml is a 1 ml. So if you take 50,000, divide it by 250, then you find you have 200 micrograms per 1 ml, a much easier number to work with. So this is your concentration. So that's our third step. The fourth step is, then we're going to figure out mics per kilo per minute. So if we want to give 3 mics, and your patient weighs 60 kilos, 3 times 60 is equal to 180 micrograms per minute. So 180 micrograms per minute is not going to help us set our pump. We want to know how many mics we want to give in a whole hour. So then we're going to multiply that by the 60 minutes. And once you do that, you find you have 10,800 micrograms per hour. So you still want to know how fast you're going to set your pump. So if you have 200 micrograms in 1 ml, and that's equal to 10,800 micrograms per x mLs. So 200x is equal to 10,800 times 1. You're going to take your 200, divide each side with the same, cross this out. 10,800 divided by 200 is equal to 54 mLs per hour. It's as simple as that. Just kind of keep it straight and practice, practice, practice. Thank you.